It's been about 9 odd months, I suppose, to be fair. And we have done much better than most people expected, because we now have, across age groups, the current situation is, in terms of the first doses, about 89% of the 60 plus, about 95% of the 45 to 59 age group, and 87% of the 18 to 44 age group have got their first dose. In fact, what's really very creditable is that in the week, or roughly about 9 days now since the vaccination for the 15 to 18 age group has started, we have already seemed to have vaccinated about 30% of that age group, which is very creditable in that sense. Right? Where there is some room for disquiet is that in terms of the second dose, which is full vaccination, which I think is increasingly being shown that is very important if you really want to protect yourself from severe disease. We now know that vaccination, especially against things like the Omicron, doesn't protect you very much from infection, but they do seem to have a strong role in protecting you from severe disease. But in terms of the second dose, the performance is not as good. In the 60 plus, about 28% remain to be vaccinated. For the 45 to 49, it's 23%, and the 18 to 44 is about 39%. And the 60 plus is especially concerning because this is a very vulnerable age group, and there is really no reason why we should not have done better in terms of vaccinating this particular. My own one-line sort of summary on how we have fared, therefore, is in absolute numbers we have fared well, but we should have been much more proactive in vaccinating the 60 plus, especially in ensuring that they got their second dose early. That's one of the issues. The second issue is structural, which is that you have a situation where our experts, the National Technical Advisory on Vaccination, have essentially said that we will have a 12 to 16 week gap for Covishield, which is our primary vaccine. It sort of does about almost 90%, slightly less than 90% of our vaccinations. So we have a very long gap between the first and the second dose. And this very long gap essentially means that a lot of the people have not got their second dose. Now this gap is the longest in the world, and other countries with the same vaccine have been given gaps around as short as about 4 weeks. So this is an issue that perhaps we need to think about more closely. The original extension of the gap, though it was justified on a relatively thin evidence, in my opinion, is something that really needs a relook at this point. So that's where we stand at this place. We've just started giving. The other issue of concern is that we've just started giving these booster doses, what we're calling precaution doses. And broadly speaking, right now, almost there's been very little uptake of those, or at least right now, because also people might be also afraid to get to vaccination centers in the middle of this particular wave. So it's less than 1 million people among the 130 odd million 60 plus years, and for much less than 1%, about 0.5% of people have actually got a precaution dose. So, and without that booster, infection by Omicron is very easy, and that is again something that therefore remains a matter of concern. Right now, what we should be doing, in my opinion, is to push out the booster to all the people who have taken second dose in the 60 plus category. We should not wait for them to come in and be boosted. We should go out and offer to boost them in the same way that we managed to reach, as I said, 30% of the teenage group in 10 days. We should definitely try and push that out if we can. We have the information. Uh, we have used our healthcare workers as manpower for checking, for doing varieties of surveys and tests. And this is a time when it's important to use that workforce to go out in these fields, especially in districts where the wave has to reach, which is, if you sort of look at the waves over time, what work that we did, we have these permanently at risk districts, which currently are the major districts which are accounting for over 50% of the vaccine of the cases. Right now, it is in the major cities, but it is moving up slowly. And we can sort of say from the past which are the districts which are more likely to get a large number of infections. And we should be pushing out this precaution dose to people above 60 and definitely to healthcare workers in these areas. Uh, and the healthcare workers is especially important because while people talk about Omicron being relatively mild, there are lots of qualifications for that. I'm happy to discuss. But the critical issue that the healthcare system is facing is not just that they are getting overloaded by patients coming in, but they are essentially getting understaffed by people, healthcare workers falling sick. This is a phenomenon that is now being seen across countries in Europe, in UK, in the US, etc. And therefore, it's important for us to try and see if we can boost our healthcare workers the same way that we've done it using school children at school and things like that. We need to ensure that precaution doses are administered to all healthcare workers at their place of work as soon as possible. There is a feeling in the system that the Omicron hospitalization rate is supposed to be lower. Uh, that is, however, not particularly well founded in the sense that there are some confounding things, right? So one of the reasons that Omicron is likely to be lower is because you have prior infections and you have had a lot of vaccine. And therefore, people who have had prior infections and have immunity, or people who have been vaccinated, or both in many cases, those people will have a level of immunity that will enable them to fight off uh, viruses much more effectively than what we call immune naive, which was the case in April and May. So, in that sense, yes, there is an issue in terms of uh, the effectiveness, the ability of Omicron to cause severe illness may be lower in certain places where there is a lot of vaccination that already taken place. But Omicron is also extremely transmissible, as you can see from the rise. We had less than 1,000 cases at the about like around Christmas or so on and so forth, and now hardly two or weeks and a few days later, less than 3 weeks later, we are at 250,000. So what we therefore need is to the latest research, and this is still very ongoing and preliminary work, seems to indicate that Omicron is about, perhaps on the basis of its intrinsic severity, and there are things that it affects the lung cells relatively lower, its ability to infect certain, enter the cells a little more difficult, etc., given its structures. But given those kinds of issues, it is perhaps about 25% less severe, which means you're looking at somebody, if it's 10 people would get severely sick, you may be, 20 people get severely sick, and I get 15 people. But since so many more people are getting infected, the number of people who will get severely sick can be quite high. And this is what we are seeing in the US, especially because the US has large numbers of unvaccinated. But we also have, as we said, a large number of unvaccinated people because it's only 60 or 70% of our population that is fully vaccinated. And there are many districts in India where the levels of vaccination are lower than the national average. What we need to do is to look at the past, look at where the disease is likely to spread early, overlap there with districts which are low vaccination. So basically, we want to look for high risk of infection and low vaccination, those kinds of districts, and make sure we are medically prepared in those areas. So, and that means ensuring that we have the oxygen, we have the ability to transport patients from there to other places, because some of these places may not have the right. So it's possible that at the end of all this, that all this preparation will come to naught. But I think it's important for us to be prepared for that, because if it happens as it could happen, given low vaccination and high infection and not so much intrinsic disease severity, we will then be caught napping, and something similar to last April, May could happen, if not all over India, but definitely in certain parts of it. You are going to have to balance the uh, ability to reduce pandemic incidence with a variety of costs that are imposed by law. What we definitely in districts which have very high levels of vaccination, let's say Delhi, it perhaps makes sense to take a graduated view and sort of, as Delhi has done, it's kept some of these things open, it has shut down some activity. You do want to reduce the amount of interaction, certainly in the some of it can happen naturally, but Delhi, Bombay, etc., which have high amounts of vaccination, should also try and reduce the levels of interaction, which might involve cutting down times, reducing certain kinds of activities, especially indoor activities. But reducing them is very important. So that's the first part. Contact tracing, I don't think is going to be particularly important at this point in time, given the extent of disease that has already taken. But definitely testing becomes important. And perhaps we already have widespread use, and there is an imbalance because in the urban areas you do have a lot of RT-PCR testing. In rural areas, you end up doing a bunch of rapid antigen tests, which can miss a bunch of cases. Testing is important because in many of these cases, among the younger people, especially vaccinated younger people, it is possible that they will be asymptomatic, but they will be infected and they will be carriers. So if a vaccinated young person has come into contact with a confirmed case of COVID, in my opinion, I think it's important for him or her to test. I know the government has given out advice which says that if you don't have any symptoms, don't test. I'm not quite sure on what basis it is being done. There has been some effort in South Africa also that's happened similarly. My own sense is since there is a possibility that a large number of young people might actually be asymptomatic carriers, it is therefore important that if they have been in contact with somebody with COVID, that they should test, at least they should take the rapid antigen test if nothing else, because it's important that their those kinds of sort of their ability to spread the disease is limited. It's the other question is what do you consider to be a symptom? Because right now we are in many parts of India uh, in the winter, and so somebody gets started to sneeze or cough, etc. It's attributed to standard winter kind of sort of symptoms, and therefore that is another issue why fewer people, even those who are symptomatic, would not want to test. And therefore, I personally disagree with the kind of advice that's gone out from the government with respect to symptomatics and testing, even for those who have been in contact with patients. So some amount of testing, I think, is important. Uh, and definitely in terms of lockdowns, etc., we need to graduate it based on what is the degree of vaccination in that particular district. Highly vaccinated areas can afford to be a little more relaxed. Low vaccinated areas need to be much more careful. And definitely one needs to limit indoor activity of larger groups as much as possible. So what we have seen so far and is something that if you are vaccinated um, and if you have been in addition, if you have been infected for sure, it does look as if that there is a pretty significant degree of protection against severe. So even if you have uh, a more intrinsically virulent uh, mutation that comes in, uh, and one would hope that that would essentially be uh, something that the population would be able to absorb without significant severe disease. Uh, is that a given? No. It's possible that depending on that particular variant that comes in, it's possible that we may have the ability to also cause severe disease, even among people who have been vaccinated. So one of the things that is important, therefore, is for us to maintain the kind of infrastructure that we have built up so far. We do have the kind of epidemiology, the kind of work that we have done in India has been much more than what we used to do in the past. That is important. But however, we must recognize that compared to even countries like South Africa, our efforts in this direction have been relatively limited. So we could have, for example, right now we're doing the precaution dose, just essentially doing a third dose of the original vaccine, because we've not done any trials at all in about what would happen if I gave vaccine to somebody who had had 2 doses of Covishield, or if I gave Covishield to 2 doses of people who have vaccine, what we are calling heterologous vaccine, different kinds of vaccines for people. In other countries, they are using these kinds of strategies. But we had the opportunity to do these kinds of studies here. We haven't done. We have the ability, we have the technical manpower to do a lot more sequencing than we are currently doing at this point in time. So it's in these kinds of areas, in kinds of basic investments in good science and monitoring, on which and communication. Because if you look at the kinds of press conferences that the scientists and health ministers in South Africa are giving out, and compare them to the kind of information that we have provided and the kind of press conferences we give, there is a world of difference. So it isn't as if that we don't have the ability to do those things. We have taken a decision not to do those things. And I think those decisions need to be reversed if we are to prepare ourselves and keep ourselves prepared for future pandemics, not just COVID-19, it may be some other disease that comes through. And with climate change, a lot of these kinds of issues might definitely come through. And we just need to have a much more prepared public health infrastructure than we had previously. I think COVID experience has shown that we can ramp up our public health infrastructure. For example, Delhi is able to move the number of beds available for COVID very significantly in very short periods of time. That's just a simple example. But we have actually managed to do much better in a variety of, much less than what I think we could have done, but definitely much better than what we did. And it's important for us to continue that trend and make that a permanent feature rather than go back to what we were.